the coronavirus newscast from the BBC.
Hello, it's Adam in the studio.
And Laura in the same studio, although 2 metres apart.
And Chris in a different studio, about 20 yards down the corridor, doing the tourist thing of trying to prop up the Big Ben thing behind me.
That's nice.
It is Fergus in Studio 62D in New Broadcasting House.
What have you got behind you?
I've got a coronavirus newscast ad.
Oh, amazing. It's the coronavirus newscast Zoom background.
Yeah, the brand, which
Amazing.
is actually available.
Available?
Yeah,
What?
we've released a virtual background for your conference calling software that looks like you're in the studio, and you even have Dino over your shoulder. Producer
No.
Dino, like in the old days.
Send me the link. I'm going to use
I
it
will
at
do.
all times.
Who needs the Golden Gate Bridge?
Now, there's lots of medical and science stuff to get through tonight, so we're joined by an actual professor. It's Professor Tom Solomon. Hello, Tom.
Hi.
And he's...
My background is my kids, if you're wondering.
Okay.
Oh, welcome.
And your professional background is you're director of the UK's Emerging Infections Research Unit at the University of Liverpool. And you're a frontline doctor. What do you do on the front line?
Well, I'm a neurologist, so in the past I've mostly focused on patients with neurological problems, and especially those with neurological infections, which is one of my research areas. But in recent weeks, like everybody else, I've been seeing lots of patients with coronavirus infections.
Okay. Now, Fergus, we've got lots of numbers to crunch today because the Office of National Statistics published their first pass on this big survey they're doing of households in England, which will take a snapshot of the coronavirus situation at that point. They published the first one today. What did it tell us?
So they surveyed 11,000 people, and they estimate, give or take a few tens of thousands, that around 150,000 people in England at the moment currently have coronavirus. That's based on swab test results. Now, that works out very, very roughly at about 1 in 400 people. That's outside, big caveat here, outside of hospitals and care homes. So that means basically that you are unlikely to bump into somebody, literally, who has coronavirus. But of course, if you're coming into work on a tube, on a train, on a bus, or walking along, you don't know who that 1 in 400 people is. So it is a reminder that social distancing remains crucial.
I'm trying to work out, Fergus, if we should be surprised at that number either being high or low.
Well, it was done at the end of April, early May, when the infection rate was already falling quite a lot. It would have been quite a lot higher in early April. But it would mean that if it stayed at that rate, and clearly the rate it goes up and down, it would take something like, I don't know, 6 years to get herd immunity. I did some very rough calculations on the calculator. So that's a long time to get up to something like 80% of the population. If you multiply, or rather divide, 66 million by 150,000 and work out at 150,000 a week.
And right now, that is another reminder that the infection rate is lower than it was, as you were suggesting there, Fergus. I mean, Professor Tom, a bit like Chris, I'm still kind of scratching my head thinking, should I be surprised by that or not? So lower than it was, but should we be worried or actually maybe relieved that it hasn't spread much further? What should we think of it?
I think the really important thing to remember here is, although this number sounds low, this is the current number. This is the current number infected at the end of 7 weeks of lockdown. And if the same study had been done at the height before the lockdown came in, it would have been much, much higher. It may have been, I mean, one can only guess, because unfortunately we weren't able to do that study at the time. But, it might have been 1 in 40, let's say. So also, I think when Fergus tries to project and says, how long would it take to get herd immunity, you've got to remember that already a lot of people are infected, and that's the crucial figure we don't know.
Can we get anywhere close at the moment to estimating how many people in total have had it?
I think that's really hard to do. I do a very ballpark figure. We know that for one person that died, for every person that died early on before there were any interventions, there were about 100 people diagnosed. and ill. So that was 1 in 100. And then for every person, this is early on, for every person there were about 10 who knew nothing about the infection at all. So as a ballpark, I might be able to say that there are about 1,000 people infected for every person that's died up to that. And we've had 33,000 that have died in this country. So that might be as much as 33 million. It might be as much as half the population infected. We just don't know yet, which is why these antibody tests are so important.
You're doing your own version of this study, aren't you, looking at infection rates?
Yeah, one of the studies that we're just about to start in Liverpool is looking at transmission in the community. It's a bit more detailed than this study, slightly different, because we're going into households and we're swabbing everybody in the household, and we're going to repeatedly do that so that we can actually get a feel for what happens when a virus comes into a household and how much it's passed on within households. And I think that will give us really important data.
Oh, so you mean, like, is it that mums get it from their kids or people get it from their workplace? I mean, what could we actually find out about that? Because there's just an assumption at the moment that, it spreads like wildfire once it gets into your home.
Exactly. Those are the critical things that we've got no idea about. And we need to know as we introduce these measures, as we ease the lockdown, as you've been hearing, the steps that are going to happen, and we will be able to see as each step happens what impact does that have on transmission, bringing the virus into the house and then spread within the house.
Shall we hear from JVT, as we've come to know him over the last few weeks? Professor Jonathan Van Tam, the Deputy Chief Medical Officer, talking about all things antibody testing at the news conference this afternoon, and that sense that there seems to be a bit of excitement about this Roche test after all of those sort of false moments of optimism over the last couple of weeks. And he set out, didn't he, in the news conference, the kind of timeline of how soon we might be able to see this.
We have been waiting for a really good antibody test to be ready. There are now at least 2 available. One of those has received its CE mark on the 28th of April, the Roche test. It has been validated by Public Health England on the 7th of May, and I anticipate that it will be rapidly rolled out in the days and weeks to come, as soon as it is practical to do so. I also anticipate that the focus will be on the National Health Service and on carers in the first instance.
So that's the Roche antibody test, big Swiss pharmaceutical giant, which says it can provide hundreds of thousands of these tests a week to the UK. They're highly accurate, but they're not a simple finger prick blood test like the ones we've talked about over the last few months, which weren't very accurate. This is highly accurate, but it involves a proper blood test, a blood draw with a needle, so it's not something you can do at home. So imagine how long it took to organise 100,000 swab tests a day, and organising tens of thousands of these, maybe 100,000 of these a day, won't be easy. So I can imagine queues at your pharmacy and special maybe drive-in health centres to go and get your coronavirus antibody test, which will tell you if you had an infection in the past, not a current infection.
Tom, what is your hunch about whether if you have coronavirus, you will then never get it again, which they call immunity in the trade, don't they?
This is the critical question. We know that usually if you have antibodies after an infection, that means you are protected against that infection, certainly for a while. And although this is a completely new coronavirus, we do know from other coronaviruses, the sorts that cause seasonal flu, that you have an infection, you have an immune response, you make antibodies against that infection, and that protects you for that season and maybe a year later. But it might be 2 or 3 years down the line, as your immunity drops, you do become vulnerable again. The important thing to say, and I've got friends in Liverpool who drive me mad about this, is we get the message out that there is more to protection against a virus infection than just antibodies. Antibodies are one of the tools. If you like, they're the foot soldiers, but there are other tools. There is cellular immunity. There are T cells, white cells, that are like the tanks. They come along and they also will kill virus. So there's a combination of things, but it's just that the antibodies are easier to measure than these defensive T cells.
And I'm going to show off now. It's called correlates of protection, isn't it? I watched an online webinar about it the other day.
You're
Oh, Adam.
So we're measuring something like an antibody, and we think that's a protection. It's a correlate. It's a measure. But the real way to know whether somebody's protected is to see what happens to them in the future. And if they never get the infection again, then you know they were protected.
Now we've talked.
The coronavirus newscast from the BBC.